Hello, I'm Dr. Jason Sutherland, a family doctor in Sudbury. As a physician, I have an interest in the health of all Northerners, and I'm committed to reducing the impacts and number of cancer-related deaths through our cancer screening programs. Too often, patients put off cancer screening. We hear patients say, "I feel well. Why should I worry about cancer screening?" Today, my message to you is simple. It's time. It's time to put your health first and to say yes to cancer screening. Cancer screening is testing done on people who may be at risk of getting cancer, but who have no symptoms and generally feel well. Screening can help us find cancers when they are small, less likely to have spread, and more likely to be treated successfully. Let's take a closer look at colorectal cancer and the importance of screening. According to Colon Cancer Check, colorectal cancer is the second most commonly diagnosed cancer. Colorectal cancer is also the second most common cause of cancer death in Ontario. Unfortunately, 1 in 15 Ontarians are expected to be diagnosed with colorectal cancer in their lifetime, and 1 in 34 is expected to die from it. Fortunately, colorectal cancer, when found early with screening, can be cured in 9 out of 10 people. Currently, colorectal screening is done mostly to detect precancerous polyps, which are growths in the colon or rectum, before they even develop into cancer. Colorectal cancer starts in the colon or rectum, which make up the large bowel of your digestive system. More than one type of screening test is available, and the one most suitable for you depends on your age and your family history. People aged 50 to 74 who do not have a family history of colorectal cancer in their first-degree relatives can screen with an at-home fecal immunochemical test, also known as a FIT kit, every 2 years. A first-degree relative is a parent, a sibling, or a child. The kit is ordered from the lab by your family doctor or nurse practitioner and mailed to you to complete at home. It comes with picture instructions to follow. There are no dietary or medication changes needed, and only one sample needs to be collected and mailed to the lab to be tested. We know that most people diagnosed with colorectal cancer don't have any family history. This means it is important to get colorectal screening as soon as you are eligible. People who do have colorectal cancer in their first-degree relatives have increased risk and should be screened with a colonoscopy at least every 10 years, starting at the age of 50. If the relative was diagnosed before the age of 50, screening should begin 10 years earlier than the age they were diagnosed, whichever comes first. Talk to your family doctor or nurse practitioner about your options for screening. Some people with no family history of colorectal cancer may have been screened with colonoscopy in the past. Screening with the easier at-home stool test may be possible if the previous results were normal. Talk to your healthcare provider about whether a colonoscopy is actually still needed in your case. You too may be eligible for the easier at-home test. Most people will get normal screening results. If there are any changes found, you will need further tests, and your healthcare provider will make the arrangements. It is important to go for any recommended follow-up tests to be able to catch any changes early. Like other screening tests, remember that colorectal screening is very effective, but it is not perfect. Sometimes, small changes can be missed, which is why regular screening is important. At any time, if you have any new or worsening symptoms like abdominal pain, a change in your bowels, or new blood in your stool, see your healthcare provider even if your last colorectal test was normal. Don't forget that there are ways for you to reduce your risk of getting colorectal cancer. People who limit alcohol, processed food, and red meat have a lower risk of developing colorectal cancer. This is also true if you eat foods high in fiber, maintain a healthy weight, and keep active. Smoking is linked to many types of cancer. There are no safe tobacco products and no safe amount of smoking. Quitting can be hard, but it is possible, and you are more likely to quit if you get help. It's time. Book an appointment with your doctor or nurse practitioner to discuss the right screening at the right time. For more information, go to www.hsnsudbury.ca/cancer screening. Please consider sharing this video with your friends and family. They too may benefit to hear that it's time for cancer screening.